Good afternoon. Good evening, everyone.
Hello, ma'am.
Hello. Just a minute. Finally. So I'm just waiting for others for a few minutes and then we'll start. Let's start. Okay. So basically, OCE, what you gonna work on your approach. So first, what is a step to step that when you are going for your exam, particularly the clinical exam, what is a clinical exam? So clinical exam is based on your scenario. As you are a physiotherapist and you are working for your case, you are working for your given scenario. Here you have to go through your content, you have to go through your reason. Clinical reasoning is extremely important in your clinical exam, particularly clinical exam. So when you are saying something to your examiner that, okay, I'm going to do particularly range of motion exercise or I'm going to do the assessment. So why? What is the reason? That is important. And how you gonna organize your structure when you are working with your OC, you have a case, how you gonna organize your verbalized thing, how you gonna organize your content in appropriate manner, that matters. So let's go begin. Particularly for the purpose of the OCE. So once you clear the OCE, you are going with the competent and the safe physiotherapists who are practicing on time. So overall your exam format is challenging, but it is achievable. You have to go with your dedication, practice, and the right strategies. Overall exam is 1.5 hours where you are working with the part 1. Here, part 1 is including case 1 and case 2. What is it? Given scenario, when you come across with the scenario, that scenario is associated with your assessment format. That scenario is associated with your treatment format. So when I'm a patient coming to you and you are a physiotherapist, you have to go through starting from your assessment to the end of the treatment. That is your case 1 and case 2. Now assessment. If I'm going with the assessment, starting whether you are accepting me till the discharge. So each and every small thing matter here. And you have to verbalize because examiner gonna identify your skill through your verbalization. So your communication skill, your verbal skill must be strong that exactly you are performing the therapy or exactly you are performing the test in your exam in front of examiner through your verbalized skill. Part 2, which is the ethical domains, there are 11 points where you have to work with your thorough basis. Ethical domain, we know the ethical domain, but the scenario, when the scenario comes, you have to identify that what is the problem, how I gonna structure that problem, how I gonna solution, I'm gonna do the solution for that problem, and then I'm gonna work with my appropriate skill within my scope of practice. So that is your part 1 and part 2. So overall, so when you are a student and when you are appearing for your exam, you have to go with your assessment skill, treatment techniques, communication, professionalism, and clinical reasoning. This thing, okay, we have to go with accepting the patient, informed consent, everything is required. But the stronghold of your technical portion, You are a physiotherapist. So your technical portion is how you're gonna do the assessment. What is your reason? So that like why I did strength testing, why I did the dermatomal testing, why I did the myotomal testing. So your stronghold for your clinical reasoning, extremely important. Your treatment techniques. So why you are treating the patient, what is the purpose, why you are working with particular treatment. For example, initially when patient is coming, we are working with the pain management. So why I'm working with the pain management versus return to the sports, why I'm working with the simulated activity. Communication and professionalism must be there. You have to be very, very professional with your patient, with your colleague, with your team, with your employer. So professionalism is like your ethical portion as well as your presentation portion, where your patient's education, consent, and your treatment, everything required. Plus clinical reasoning. So after doing my all the assessment, why I am selecting the differential diagnosis, why I am selecting my particular diagnosis, that is known as a clinical reasoning. Why I am selecting my treatment for the given scenario. So you need to go with your reason that if I am giving grade 1, what is the reason behind the grade 1? To reduce the pain. Grade 2, to reduce the pain as well as improve the range. If I am giving cryotherapy, what is the reason for the cryotherapy? If I am not giving the cryotherapy, what is the reason for not giving the cold pack? So all the treatment must be rationalized. All the sorry, all the assessment must be rationalized. Your technique, your approach, be professional, and you are going to thoroughly your performance in your exam through your verbal skill. So for that, you need to write it down your points. Otherwise, you will forget. So whatever given scenario is given, you have to go thoroughly with your given points. Strategy. So here the strategy works. We know that technical portion they're going to evaluate is assessment, treatment, communication, professionalism, clinical reasoning. That is my technical portion. But strategies, my understanding about the blueprint. Now blueprint means core content. I need to know the content. If the given scenario is frozen shoulder, what is a frozen shoulder? Given scenario is a CABG. What is a CABG? What is a rehab protocol physiotherapy point of view? So my knowledge, my content must be thorough through the given scenario. It is not like just I'm getting the case scenario of the CABG, all the patient is the same. No, CABG 72-year-old and CABG with the 60-year-old. Both has a different scenario. 60-year is a business person, very active. 72 is a housewoman. So given scenario, given age limit, given circumstance, and your core concept of the topic must be there. Plus your time management. Now, my point with your time management is extremely important. Exam going student particularly. Work with your time limit. Do not bluff out. The thing is, you know everything. You want to say everything. Please, because the thing is, you are working with your time. So priority is important. What to say in priority. How you gonna organize your structure in your each and every verbalization. For example, frozen shoulder, patient is coming. I want to say about assessment portion. I want to say about the capsular tightness. I want to say about my mobilization technique, priority. Rather than you are saying one thing, capsular pattern, round and round 3 to 4 times. You are wasting your time. One time you are saying that capsular pattern is there. You know the capsular pattern. As the examiner, I am aware. So very important point is how you're going to manage your time in your given scenario. Hands-on skill. Hands-on skill. Now, again, I told this is your online exam. Hands-on skill basically when in the early stage, when we have a represent ourselves in front of the examiner on the model, I have to say about the safety technique. I have to say about the treatment portion or the assessment portion. But sometimes whenever I am performing and by chance I didn't verbalize, it's okay. Because I am performing, he is watching me, that's fine. But in this exam, when you are going online, your accuracy, your efficiency to provide all the information, same like you are performing on the patient, that is critical. You understand what I mean? If you are working with this case scenario where the assessment technique or the MMT or the myotome, for example, I am checking myotome. So in practical, I will give the registers, patient is a strong, I will verbalize that, okay, I can see the patient is a bilateral quadriceps is strong, L3 myotome is normal. So it's okay. But when I'm going to verbalize my stuff, myotome hold must be 5 seconds. So that way examiner come to know that, okay, she has a thorough idea. So this verbalization online, you are representing your hands-on skill through your technique, through your communication. So accuracy, efficiency, extremely important. Strong communication, clear explanation, patient-centered approach do matter. If you are not clearly explained, you are again going round and round. It's not valid. To the point, with rational, with clinical reasoning. If you don't know, that's okay. Don't be panic. Something is missing. That's fine. But you are trying to catch. Stay calm and professional. Your confidence, your concentration on your given scenario, and when you are working, when you are doing practice, I feel like, okay, I will say this, I will say this. In the real exam scenario, under pressure, something is gonna miss. And in between, you think that, oh, I didn't say the consent. So you are starting your assessment, you are reaching to the MMT, and in between you are saying that, okay, I will take the consent with my patient by giving all the information. So you come to know that, okay, how you gonna feel when I'm gonna say this thing? That, okay, you are my examiner, I am a student, and I'm gonna say, in the given scenario, assessment is going with range of motion, MMT, this is my objective examination, and even in between, okay, first of all, I am going with the informed consent of my patient. So this is irrelevant. So your structure must be organized, and that comes with your practice. And those who are exam going students, for them, your points written on your whiteboard is matter, because you are mentioning that thing right away, you are not gonna forget. So I will say rather than write it down. That is important. Concentration of the keywords. So this is the overall scenario where you are working with your strategies, that you are understanding, you are practicing hands-on skill, communication, and the calming behavior. How to start? So you are understanding your case by your own way, by your own style of judgment. Again, script is yours. You are not gonna mug up the script. You are not gonna work on your the overall thing that, okay, I have to go with the this MSK, I'm gonna say this, I'm gonna say this. No. What is the given scenario? What is your judgment? What is your knowledge? Work on that. Even though sometimes you are wrong, if you pick up the keywords and try to work on that, fine. Stay calm. Organize the information. What is the pathology which is given in this scenario? What is the area of practice, whether it is inpatient or outpatient, whether it is MSK, neuro, cardio, pulmonary. Whatever you are doing, subjective examination, objective examination, treatment, clinical reasoning, why you are doing, why not you are not doing. As per the case 1 and case 2. Easy way. So when you are note it down that, okay, what is my given scenario, pathology, first thing, inpatient, outpatient, or the critical, non-critical patient, reasoning. Your organizing work must be, again, do not miss any key point. So you are going for the exam. It's not like, okay, that's okay, that's okay. Everything is not okay. You have to go with the critical points, analyze your stuff. So ensure that you are going with the key points. Focus on the words which is given, because here also online exam scenario is your patient, you are performer, like a hands-on skill, you are explaining to the examiner. Whiteboard, important because you are going to write everything. Keywords. Structured one by one means you are in your whiteboard, you are mentioning something like treatment here and your problem list is downgrade. Your verbalization is also like this way. So structured one by one. First is the problem list, then the short-term goal, long-term goal. For the short-term goal, what you gonna treatment? This thing is important when you are writing down, when you are doing practice. And then lastly, timely manner verbalized. So this is important. Focus on very important points as per the case. Now what to focus? Now coming with the real scenario, which is the given case. Let's go with the one case here. Have a read. So in the given scenario, so overall scenario where the patient 35 years of age, so age do matter. Here the occupation, he is the office manager. He has a chronic lower back pain. Past 2 years, worsen in the last 4 months. What is his difficulty? Sitting for the prolonged period. Morning stiffness, physiotherapy, massage therapy, and the chiropractic treatment for the minimal relief. MRI. MRI revealed the nerve root compression, spasm, and degenerative joint disease. Along with persistent pain, neurological symptoms, finally he is underwent discectomy, so surgery is already done. Now the post-operative surgical thing is given. Personalized factor, he is the only income generating person. He is associated with the prolonged sitting, occasionally lifting. He is enjoying the basketball and is worried about the returning to the sports, returning to the work, returning to the normal life. So this is a one case. In that scenario, your verbalization. So first you are going, do you accept this patient or not accepting the patient? Starting with the very, very basic thing. So here, what to focus? So you are accepting or not accepting. If you are going with the acceptance, then we are working with the consent. So now let's go with the acceptance. For the acceptance, it is a critical step. Now reason why I am analyze myself for the accepting. So if I'm going to do the accept the patient, I'm going to analyze myself so I can provide safe treatment, professional treatment with the patient-centered approach. Greeting, professionalism, communication skill is important. While I am accepting the thing, I have to go with my checklist. That okay, consent, yes, patient is able to give the consent, so I am good to go ahead. There is no contraindication or the red flag for the given scenario. The surgery is done, referral is there, there is nothing is red flag that I cannot go ahead. So checklist is okay. This is within my scope of practice. Okay. There is no ethical conflict is going on. Okay. And I can treat the patient safely. So this finalize my words that, okay, I'm going to accept my patient because my patient is cognitively good. He can give the consent if I'm explaining the information. There is no contraindication. There is no red flag. The area of the practice, which is the laminectomy post-surgical thing, is my scope of practice. I can see there is no ethical conflict is going to be happen and I can treat, I can assess and treat my patient safely. That's why I will accept my patient. But at the same time, in the given scenario, patient has a saddle anesthesia. Patient complaining about the urinary incontinence. Patient has the gait disturbance. So here, or patient is cognitively not good. So consent, if not obtained, we have another chances of the SDM or the implied consent, we will think. But along with that, saddle anesthesia, red flag is there. So given scenario having a red flag, given scenario patient is showing some symptoms which is not my scope of practice, sedal anesthesia, urinary incontinence, has to be evaluated medically rather than physiotherapy point of view. So I cannot safely assess or treat my patient. I am not going to accepting the patient. Your reason must be strong when you are accepting or not accepting the patient. So that is your first thing. Second thing, when you are going with the consent. So this is the ethics component, that what is your informed consent, where you're going to explain benefit, when you're going to explain the importance of the exercise, risk associated with not being the exercise. There are many alternative options. Along with that, you're going to explain each and every points with allowing the patient time to ask the question and you're going to address the concern of this patient. It is known as informed consent. And after that, you can start with your subjective objective examination as per the given scenario, case 1. And if you are working with the case 2, you are working with the problem list, short-term goal, treatment for the short-term goal, long-term goal, collaboration, discharge planning. That is your case 2. So far, any question, anyone? All good? Okay. So in this given scenario, your keywords. So what is your keywords? Age, occupation, patient has a previously continuous chronic lower back pain, patient has a condition is worsen, job as a high sitting job, prolonged sitting job, previously therapy is taken. So this is the previous thing, MRI is done, but the present complaint. So presently patient is post-operatively. Disectomy is done. Present symptoms, present inability of the performance. So this is your given scenario keywords. So easy and ready with your keywords. Start explaining in structured manner that I am accepting the patient, what are the reasons. Before going onwards, I am going with the informed consent and what are the component of the informed consent. Use up to the point of explanation. It's not like, okay, I'm going to ask this thing, I'm going to ask this thing, along with that I'm going to ask this thing. So this is like long sentence and you are covering 2 to 3 points. But instead of that, you are saying that in the informed consent, I will explain the benefit, effect of the exercise, risk associated with not being treated, consequences. If patient is not interested, few alternative option is also there. Along with that, I am giving the time to ask the patient and I will address the concern. So one sentence, organized, structured way, you're going to explain examiner what is informed consent and how you're going to proceed with your patient in a professional manner. Clear communication, clear, up to the point of explanation is required. Verbalize as it is your virtual exam again, and complete your station with clinical reasoning. Station means your scenario. So clinical reasoning, why I am doing this thing, this is the reason, that's why I am doing it. That's it. So clinical reasoning do matter. That gives me idea about my student for his clarity of the topic, clarity of his performance, and safety. So here you require verbal skill, content, organization, strong hold on your keywords, and your own rationale with the clinical judgment. Might be my rationale is different, your rationale is different. You are focusing with early mobilization and early return to the work because patient is a primary income person. And for me, I am going with the safety and I want to focus with the strengthening exercise once patient is stronger enough to stay for more than 30 minutes sitting. Then I can allow him to go with the job. So both has a different opinion. It's okay. Every student has a different opinion. That's fine. As long as you have a reason. Clear? So accepting the patient is done. How to respond? So when you are saying yes, what is your answer? When you are saying no, what is your answer? If in between you are coming with the probing question. So this is normal. If you are saying accepting and informed consent and right away you are getting some question that, okay, why you are doing this? What is the thing? If patient is saying no, what you gonna do? So ready with the answer, ready with this unexpected situation may happen. So here you're gonna acknowledge the concern professionally that okay, I will acknowledge if my patient say no, I don't want to go with the treatment, it is very painful. Burns patient, it is very painful. Post-operative patient, painful. So I will explain my patient that what is the benefit, and if you have a pain, I will address that pain along with the treatment with lies with the pain medication. So explaining why you are working, and if patients still say no, I will respect his wish because I am working with the autonomy of my patient. So here your ethical point is there. That's why you are not proceeding. And if I am not proceeding, I will also give some recommendation for the alternative. So you are not leaving your patient in the middle. So appropriate referral, appropriate evaluation. If patient has a communication problem, interpreter is there. And remain calm, patient-centered approach. Don't be, see, I see many students when I'm asking all of a sudden that, okay, what is this? And then their whole answer is changed. They forgot, they disturb. So be ready. If you are mentally ready, you can easily answer. One more thing, do not give answer right away. If I'm going to say that, okay, patient is not understanding what you are saying, he is not interested, and you are suddenly started, yes, in that case what I'm going to do, I'm going to ask the patient and I'm going to explain this. No, take your time. That okay, take give me a second, I will think and I will answer. So that gives you moment to organize your stuff. That gives you moment to give you the idea, to give the answer with your clinical reason. So that is important in your exam. That do not give fast answer, do not give slow answer, do not give the answer with taking a pause. Proceed. So when you are going with the case one, accepting informed consent is there, you are going with the subjective examination. So basically this step is crucial because here it requires the clinical reasoning, identify the red flag and determine your working diagnosis. Present complaint, why the patient is here, that is important. Now question goes to NIPA, what is the reason for understanding presenting complaint? Why this is important?
So, ma'am, history of present illness is important so that we can know what are the current concerns of my patient, and also this gives me an idea to concise my objective assessment. Also, it will be giving me an idea what all structures are involved involved, and also how this will guide me for more clinical reasoning for my objective assessment.
Correct. So basically, when I'm asking what is your main concern today to come to the physiotherapy, open-ended question. So patient is saying n number of the thing what he is suffering. If patient has a shoulder pain, might be as a neck pain, might be as a referred pain, might be as a difficulty to overhead position, might be as a difficulty with the sleeping in the night. Same thing, the post-operative patient, if I'm asking why today you are here, post-operative day 2, day 1 or post-operative 1 week. I right now my concern is pain, I am not able to sit. So whatever patient concern, it is there when you are working with the presenting complaint. It gives you the idea that okay, what are the thorough things that I need to focus in the given case. It understands the main issues. It determines the severity of the condition. It gives me priority that what point I gonna work priority basis. And it gives me idea whether my patient is frustrated, anxious, what is my patient's expectation, or whether my patient is interested to involve in the therapy. So this is overall your explanation that okay, this gives the idea that why my patient is there, what is the important point, and how I can proceed further. So what you gonna ask in subjective examination, Kruti?
Yes, ma'am.
So what you gonna ask particularly in the subjective examination, particularly given this scenario?
So firstly, I would like to start with the subjective for the present history of the illness. So I will mention
Present
the
complaint.
rationale, yes, why I'm going to do. Then I will proceed with the asking the pain related questions. So I will be using the old scrap method. So I'll be starting with asking like what was the the onset of the pain, when it started, was it a gradual or was it a sudden. I will also ask about the as a given a case that my patient is having a pain at the lower back pain, but I would like to also ask, is there any other areas my patient is experiencing pain. Also, I will be asked the duration of the pain, like since long they are experiencing this pain. Then moving forward, I can ask about the characteristic of pain, like how they are like what kind of pain they are
So
experiencing.
overall pain. Then
Yes. Then pain. Then I will be asking about ADLs. That does that ADLs is affected because of their current condition and how they are managing it. Do they need support or they are able to do independently?
next.
Another thing I will be asking about using any gait aid for a support.
So that
Then
is
I will
also
be
important.
asking any home modifications they have done, such as using grab bars or any railings.
So
Then
basically, yeah, go
yeah,
ahead.
yeah. So yeah,
That
this
is
is
main thing. So basically, post-operative, your post-surgical status is important. So here, subjective examination, you are asking with the main issue, which is the pain. What is the location of the pain? What is the onset of the pain? Nature of the pain? Radiation, whether it is radiating pain, not radiating pain, severity of the pain, aggravating factor, relieving factor. Along with that, all the subjective what patient can provide to me. Now here, occupation, his home modification, his activity performance, his current limitation, his recreational activity concern. So this is comes with the social and functional limitation because that portion patient can provide. It's not me. Red flags. So basically first with the subjective examination, what I can find out, there is no unexpected weight loss. There is no constant pain or the night pain, no bowel and bladder involvement, or there is no progressive neurological deficit. So there is no red flag. Yellow, yes, patient is fearful, anxious. He is only bread and butter. So stress and the avoidance behavior. So he stop all the activities, which is a yellow flag, delay the recovery. Plus subjective examination, patient goal and expectation do in the subjective examination. So what is my patient goal comes under your subjective examination, that okay, it is reduce the back stiffness and discomfort. It improves the spinal mobility and the strength. Overall, my patient wants. So whatever my patient says, it comes under my subjective examination with rational. So the big question is why subjective examination is important in the physiotherapy. Already we discussed this thing, that identify the causing factor, that understanding how, when and why the symptoms started. Physiotherapists can determine that whether the condition is due to the repetitive trauma, postural issue, underlying pathology, here surgical thing. It gives me the baseline idea that okay, what is my baseline idea? For that I can work ahead, and it gives me safety, like it gives me the idea to provide the safe, effective and personalized rehabilitation plan. Out of this scenario, my subjective thing is my patient has a pain. Post-surgically, my patient is end up with the pain because of the surgical issues, incisional. So I'm going with the incisional thing. I'm going with the pain factor analysis in a subjective manner. What is the aggravating factor, relieving factor? What is the pain medication? Along with that, my patient's social limitation as well as functional limitation assessment, where I'm asking the question about his ADL performance, his any assistive device he's using it, any activity which hamper or which affect her overall performance, and what is his goal regarding the return to the work, what is the goal regarding his return to the sports. So that gives me the baseline idea about going further for my objective examination. And then objective examination, Vidhi, go ahead. What are the points you're going to cover in objective examination?
So proceeding with my objective examination, first we'll take an informed consent and then we will explain the patient that what we are going to do. So the patient is aware about those things. Then firstly in my objective, I would be performing an observation where I would be looking for the patient's attitude of the limb, deformity. I would be looking the patient local site. And also I would be doing the patient postural assessment and then gait assessment. Then once I'm done with an objective like observation, then I would be proceeding with a range of motion testing. In that, it would be active and the passive range of motion. This will help me to find out whether the patient is having any joint stiffness or the reduced in the mobility. Then I would like to do the strength assessment, where first I will be doing the resisted isometrics for the particular joint, and then for an individual muscle, I would like to do the manual muscle testing. Then I would do some neurological testing, where it will be included some dermatomal, myotomal, and the reflex check. And later on, I would also check the patient functional measure, because it might affect the patient activities of daily living. So in that, we would be doing the sit to stand, standing, and those things. And then at the end, I will be doing special test and outcome measure and the palpation technique, which would help me to confirm the diagnosis.
So palpation is in between.
Okay.
Okay. Regarding the observation, regarding the objective examination, objective means what therapist is doing on the patient. Here also you need informed consent. Subjective means all the story what patient is saying to you. You are asking open-ended questions. Your communication with your patient, gaining a trust, involve the patient in the rehab. But when you are performing your objective examination, again you need informed consent, because patient is not aware that you are going to touch. You are going to perform the special test, which might be painful. So informed consent here is extremely important. Along with that, first is on observation, on palpation. With you didn't say these things. So on observation is the first, on palpation, and on examination. So your criteria is divided into the three: on observation, on palpation, and on examination. On observation, you are going to assess local site, where redness, swelling, texture, you can see just on observation what you can see on your patient. Incision is there, whether the incision is healed or under dressing. Any oozing or any suspicious pus is coming out of the incision, or incision is overall well. There is a normal incision is there with the stitches. You can see as a on observation. On observation, you can analyze the posture. Now, when posture analysis, you are going with the front, side, and back to get the idea. Patient must be in the minimal cloth. So you can get the exact idea about the curvature. It is patient wish. Once postural analysis is done, you get the most of the idea that what is the deviation, where patient feel pain, and what is the cause. Along with that, if patient has this postoperatively gait. So gait observation, only observation, you're going to observe the gait along with patient is using any assisted device. Then palpation, where you are working with the touch. So you are on the palpatory technique, you can use identification of the tenderness, tightness, tone. If the tone, you can palpate as well. If the muscle is contracted, so 3T, tightness, tone, and temperature. Tenderness, sensation, that is also you can do with the palpatory technique. So on palpation, you can incision, if the incision is there, whether it is a mobile incision or the other incision. Pain with the palpation, you can go ahead with the palpatory technique. And then on examination. So on examination, first is active range of motion. So why active? It gives me idea about the contractile property of the muscle, and it gives me idea about the active movement. Passive means if active is limited, passive is full muscle weakness. Active is limited, passive is also limited, there is a bony block or there is articular problem. So AROM and PROM assessment, what is the rational? Registered isometric movement gives me idea about the properties. Okay, whether patient has a sprain, strain, fracture. So that gives me idea about the registered isometric movement. And then strength assessment, if it is a MSK scenario, if it is a neurological, you are going with the tonal examination. Neurological examination for this scenario, post-surgical laminectomy, where we are working with the dermatome, myotome. For the dermatome, we are using the dermatomal distribution. For the myotome, we are using the E muscles. For the isometric hold for 5 seconds, compare both the sides. So it gives me the idea about my patient's neurological involvement. Overall, after that, functional assessment. And then I'm using the outcome scale, gives me the objective idea about the patient scenario. So outcome measure and then finalize. So this is my objective examination on observation, on palpation, on examination, A-ROM, P-ROM, RIMS, neurological examination, and the functional test. So this thorough examination each and every time informed consent, patient awareness, patient know that what I'm going to do. And that baseline data helps me to give me the exact idea or exact picture of my patient, that where he is there today, what point I need to work, so I will give him better life next time. So this is my case 1, where I'm working with the subjective and objective examination. Versus the part 2. Part 2 means if I'm going with the examination, I understood that what is my patient's problem list. And on that problem list, I can work with a short-term goal, long-term goal. I will make a treatment plan. If any consultation, collaboration, referral is needed, I can work, I can monitor my patient progress. If my patient is not progressive, I can modify the treatment. I will do the self-management, and finally, I will discharge my patient. So overall, this gives me the idea about the complete treatment, starting from accept to the discharge. Problem list. So here the problem list for the given scenario, post-surgical laminectomy or discectomy. Here MSK problem. Maybe neurological is there, neurological problem. So problem list is whether patient's range of motion, strength, weakness, tightness, postural, loss of the lordosis, or there is a postural deviation. Patient might have a neurological involvement, and according to that, the problem list is there. Functional limitation. So patient is not able to sit for more than 30 minutes. Functional limitation. Patient psychological concern. That okay, patient is stressful, anxious, anger, some because he's not recovered, the time duration is going on and he is stuck with the bed, he's not able to go for the job, not going for the recreational activity. So these all are the problem list where I have to work with keeping my patient in the center by using appropriate referral, appropriate technique, and appropriate intervention. Working with a short-term goal. Now, short-term goal, it is applicable to each and every patient. MSK, neuro, cardio, pulmonary short-term goals are must be specific, measurable, realistic, timely manner. Now, what is the SMART principle? So, SMART principle guide me the idea about my post-surgical phase. So, in this given scenario, my patient is a maximum protection phase. I am working with the precaution, safety, surgeon's opinion do matter. I am working with the surgeon referral, weight bearing status, removal of the the brace, weightlifting strategy. All is protocol decided by the surgeon. Healing time. Now I am addressing the patient's immediate problem. That is also my short-term goal. Functional relevance. So back to the functional activity, which is a daily activity with consideration of psychological and sociological factors. So this is my goal. And when I'm going with the SMART goal, for example, pain reduction, very, very simple goal. Please give me one goal, Krishna. One goal for this post-surgical laminectomy patient, short-term goal.
So for this patient, I would like to reduce my pain, evaluating through numerical pain rating scale from the current. For example, if patient is having 8 out of 10, I would like to reduce it 6 out of 10 within the next 1 week by incorporating some pain management strategies, educations about pain provoking strategies, and also the cryotherapy. I choose this goal as by reducing patient's pain, he can participate more in the rehabilitations program.
So basically it's the short-term goal where you are working with one goal, for example, reduce the pain. So if you are selecting this goal, why you are selecting this goal? Because pain is reduced, patient willingly participate in other activities. So now go with the specific. So clear, well-defined goal is pain reduction, measuring by NPRS from 8 to 6. So I have a particular range, time bound within a 1 week, and relevant. I'm gonna achieve this goal by working with the cryotherapy, by working with the positional strategy, by working with the patient's pain medications. So this goal gives me the idea with the thorough performance to achieve the pain-free movement. And I have a time bound. So whenever you are saying this goal to the examiner come to know you are working with the patient-centered approach in a timely manner, safely and effectively. Now this is the MSK goal. For example, patient has a pulmonary patient has a secretion. For that scenario, Kruti, what is your goal for the pulmonary scenario and short-term goal?
Yes, ma'am. So for the pulmonary, I would like to reduce any complications such as atelectasis and the pneumonia. For that, prior to discharge, by incorporating the strategies such as breathing exercises and uh, yes, breathing exercises in the treatment plan. I selected this goal as it will improve my patient lung capacity and also risk of the any pulmonary complications.
How are you gonna measure?
Like to measure it by using the O2 level by using SpO2 pulse oximeter, or also by I can auscultate it.
So basically you are prevent the complication, which is your short-term goal. So whatever short-term goal you decide, that's okay. As long as you are making a smart goal. Okay, for example, another is the sputum reduction. You have a complication prevention. So complication prevention, atelectasis, I will prevent it by improving the patient's lung capacity, measuring with the SpO2, by providing the ambulation as well as the inspiratory exercise with the breath hold in a 1 to 2 weeks. Basically, short-term goal up to 2 to 4 weeks. Or if it is more like 4 to 6 weeks, 6 weeks beyond, we are not working with the short-term goal. Clear? Same way, long-term goal. Long-term goal for this case, post-surgical. So long-term goal is a full recovery, full functional independence, return to work, return to sports. Long-term goal is also realistic, reliable, measurable, patient-centered approach, and we are considering the nature of the injury, rehab progression, and patient expectation. Final objectives for these long-term goals are align our natural healing time. So if I'm gonna say, I'm gonna say that okay, my patient is going to recover within a 6 weeks. Laminectomy is happen. Patient has a natural healing time is 3 months. So we have to wait for that. So long-term goal is always with the natural healing time, address patient's functional and the strength requirement, incorporate sport-specific or work-specific demand, which is known as simulated environment. Along with that, patient's fear, patient's psychological component must be matter. So must incorporate that thing. So here also your objective must be clear that I'm going to work for my patient to return to the work, which require the prolonged sitting. Laminectomy, no more than 30 minutes is allowed at, which leading to the increased discal pressure. So I will educate my patient, but I am working with the strength of the back extension muscles as well as the endurance. This goal I will achieve by providing the exercise in a graded manner. So I'm not going to force my patient to go with the right away strengthening exercise with the resistance within a 8 to 10 weeks. Or if it is a laminectomy, because generally it takes time, 2 to 3 months. So that way I will prepare my patient back to the work. So long-term goal is also with the SMART principle. Why you are choosing this goal, what is the significance of this goal, and how you gonna go ahead. That is your long-term goal. Clear now? Along with that, I told you that patient has the psychological stress. Patient is the only bread and butter. So your referral, your consultation, and your collaboration. Here, family member, friends with patient consent, caregivers, nurse, when to report to the nurse, when to involve the nurse, your rationale must be present. So regarding the pain medication, regarding the schedule of the medication, if patient is a bedridden, bed turning schedule, patient has the bladder and bowel activity, that bladder and bowel activity schedule. patient forgot the medication, everything associated with the nurse. If weight bearing status, patient has the new symptoms, patient has the fever, patient has the infection, surgeon or the general physician. Patient want to do something regarding the diet, something regarding the weight management protocol, or you see that cystic fibrosis patient weight is reduced. Post-surgical patient is not mobile, is eating a lot, leading to the weight gain. Again, there is an injury to the back. So here, scope of practice as a physiotherapist, I cannot comment on the diet, refer to the dietitian or the nutrition therapist. Patient has a speech problem, language problem, SLP. Chiropractor, if it is involved, with consent, you can go ahead and communicate, which is known as collaboration. Same way, registered massage therapist, social worker, if patient has a financial issues, patient has a social determinants. Yes, subjective, you can go with the social determinants. And according to that, here you can collaborate with the social worker, counselor. If you are working with the PTA, so PTA you're gonna involve, and here ethics of the PTA, that how you're gonna review your PTA's competency. Your mind must be ready to answer this question, might be you get the probing question. And then if you are not getting the appropriate success, or some happen like the abuse happen, or you feel there is a yellow zone between the professional boundaries, still it is ethical thing, refer to the other physiotherapist is there. So overall, in your keep mind, you have to work with the referral, consultation and collaboration of the given scenario with rational. Now, based on the target, you are doing your exercise protocol, you are doing your short-term goals. So what portion you are working? What goal you are working for? What significance? SMART goal. How you gonna perform? When you gonna use the necessary session? When you gonna reassess the patient? And why you are doing this? Because I am tracking my patient's progress. I am tracking that whether it's improving, not improving, or any modification is required throughout the session. It is not like one time patient is coming, you are doing initial assessment and you are making a treatment plan. No, you are thoroughly examine the patient each and every time. For example, measuring a pain scale, same pain scale on the different day, you can get the idea. Discharge plan. When you are working with the discharge plan, you have to work with the progress, reassess the patient, like assessment, like reassessment on the patient, what goals I expected, and right now what is my goal. Based on that, I decide that whether I can discharge my patient or not discharge. Education, because education regarding safety, regarding precaution, regarding absolute contraindication, along with home exercise plan. So basically, whenever I am doing discharge plan, my patient is ready, but my goal is achieved, I need to discharge. So overall, I have to work with the customized way. Okay, question goes to Nipa. In the given scenario, post-surgical laminectomy, when you gonna decide your discharge plan? When you gonna perform your discharge plan?
Okay, so ma'am, in the given scenario, post laminectomy, I would discharge my patient if their goals or the milestones that we had planned are achieved, and if some of the goals even are not achieved, and if if patient is able to manage those by themselves by teaching them a home exercise program, then my patient is ready for the discharge. Here I will consider various factors such as patient's financial factor, patient's psychosocial, if patient is needing any kind of arrangement regarding the support at home. Are they in need of any personal support worker for the assistant? Appropriate arrangement in terms of gait aid or any home adaptations, and proper education about the do's and don'ts after post surgery. Also, I would educate them regarding the condition and the phases of the recovery, and also I will provide my patient with all the reassurance. So this way,
Yeah,
I
go ahead.
can plan my discharge.
See, discharge plan. When I am saying the word discharge plan, what is this discharge plan? I am discharging my patient. So there are multiple factors. Only one factor is goal is achieved. Second factor, patient financially not stable. He is not going to pay if he is not able to do this. Third thing is patient is relocated. So I'm just giving example, there are multiple factors. So whenever you are discharging the patient, you have a rationale that why I am discharging the patient. Clear? If MVA client, I am discharging my care. So MVA client might be having a chronic pain, but this is managed by the home. There is no need for the active therapy. So maintenance is not a physiotherapy. So here I can rationalize my discharge plan by mentioning about what is my patient's progress status, what is the overall assessment in terms of the goal is achieved, goal is not achieved, whether it is safe to discharge, what is the patient consideration in terms of financial stuff, in terms of the patient's difficulty to come to the physiotherapy clinic and manage at the home, or in terms to the patient is arranged the home physios. So I need to discharge from my care. We have to personalize each and every patient accordingly. So discharge plan is not only goal is achieved, there are multiple factors comes when I am discharging. If suddenly patient started the bowel bladder activity in difficulty, so I need to discharge from the physiotherapy and go with the emergency. That way, we are working with our discharge plan. Arrange the support on the basis of the reassessment. So finally, when I'm going to discharge my patient, at the time of discharge, what is overall status of my patient? They need support. I have to arrange the support. Example, patient has the problem with the transportation, arrangement of the transit, community support group because patient is discharged, maintenance is there. So maintenance go with the community support group. Patient is depressed, motivation, support group along with discharge report, which is known as discharge summary. That what is your overall discharge planning, what is your discharge summary, and how you're gonna go ahead with the further transition or further stop of the treatment by providing home exercise plan with the pictorial diagram and patient's understanding. That is your finally discharge. So discharge report where your short-term goal achieved, what is remain to achieve, your outcome measures which give the clarity, home exercise plan, follow-up, contact details of the clinic with hours, emergency step, what collaborations you gonna go ahead with the family physician, safety precautions and contraindication that patient should not do when he is at discharge at home. Overall, you have to understood when you're gonna verbalize your stuff in the case 1 and case 2. Any question? Anything that you didn't know? All good? So finally, we are working with this. Now coming with the ethical domain. Ethical domain, first, ethically we have a, just a minute. Sorry. First, ethically we have a 11 domains. Supervision of and assign the care to the support personnel, which is PTA. Expectation regarding fee, billing and account. Addressing the discrepancies, conflict, confidentiality, privacy, infection control, professional boundaries, ethical issues, priority of the care, physical and emotional safety, and communication. Overall, in the ethics domain, because you are getting the scenario, but in the ethics domain, you have to spot the problem that, okay, what is my issue? Gather the fact, collect the information, what is your scope of practice and what is happened. Maybe the wrong thing happened, so you have to collect the wrong information also to verbalize your stuff. Think of the option, brainstorming. Then pick the best one in the priority list. Implement your action and then finally review that, okay, overall I am doing this ethically. PT and PTA problem. So PTA problem, PTA gives the stretching which is not required. Okay, sometimes PTA gives the resistance training with the 10 pound and you are just saying the 5 pound. Patient is end up with the more pain. So here you're going to identify the problem, patient-centered approach. So apologize the patient is very first thing. You're going to gather the fact that, okay, what thing PTA does wrong? What thing from my side for the delivering a task or delegation of the task going wrong, whether it is wrong or right. I have to think the possible options. So first priority of the patient-centered approach. I'm going with my patient. I'm going to acknowledge him, apologize him. I'm going to work to reduce the soreness. What are the possible solutions? If patient has a THR, something is severe pain, refer to the emergency, or it is manageable, I will give the ice application. I will take consideration personally for this patient. And then I'm going to the PTA. So PTA must understand his role, his duty while performing the therapy with the patient. When I am a physiotherapist, I need to evaluate my PTS competency with the review and all. So this competency checklist we have to verbalize. That gives us the idea that, okay, what is the sequence that I have to check the competency of the PTA. I have to inform the PTA that she should not increase the weight without the permission. And whatever she is doing wrong, responsibility comes under the physiotherapy. So she should know. And if she is competent, and if patient is ready, then you're going to incorporate. Patient is not ready, you are not allowing PTA to treat the same patient, because we have to work with the patient's autonomy. Professionally, communication do matter. Here, physical and emotional safety. Patient may be disturbed, patient may be depressed. Patient is already going from the THR, and on the top, patient has another pain. So that safety also matter. We have to work on that domain as well. And everything finally we have to document in patient record, in our professional record. If something abuse is there, we have to mandatory reporting. Everything we have to organize with this 6 component when we are verbalize our ethical domain. Clear? Any question? So this is overall your exam point of view, that okay, how you gonna navigate your exam through the one by organizing your structure, document your things. You are going with the critical thinking, you are going with the one by one step, and ready with the probing questions. Any question?
No, ma'am.
Thank you. See
Thank you,
guys.
ma'am.
You're welcome.
Thank you.
Ma'am.